All right, so this is something that we have been expecting for a while now, and it's finally here. The FDA has officially approved, fully approved the Phizer-BioNTech vaccine. So let's go ahead and read this little press release that they put together here, and then I'll talk about what my thoughts on this are. So FDA approves first COVID-19 vaccine. Approval signifies key achievement in public health. Okay. Today, the U.S. Food and Drug Administration approved the first COVID-19 vaccine. The vaccine has been known as the Phizer-BioNTech COVID-19 vaccine and will now be marketed as Comirnaty. I guess I'm pronouncing that correctly, hopefully. Comirnaty, weird name, okay? For the prevention of COVID-19 disease in individuals 16 years of age and older. The vaccine also continues to be available under emergency use authorization for individuals 12 through 13 years or 15 years of age, and for the administration of a third dose in certain immunocompromised individuals. And they say, quote, "The FDA's approval of this vaccine is a milestone as we continue to battle the COVID-19 pandemic. While this and other vaccines have met the FDA's rigorous scientific standards for emergency use authorization as the first FDA-approved COVID-19 vaccine, the public can be very confident that this vaccine meets the high standards for safety, effectiveness, and manufacturing quality the FDA requires of an approved product," said Acting FDA Commissioner Janet Woodcock. While millions of people have already safely received the COVID-19 vaccines, we recognize that for some, the FDA approval of a vaccine may now instill additional confidence to get vaccinated, and today's milestone puts us one step closer to altering the course of this pandemic. So that's the press release of what they had to say. Now, I think this could have pretty big implications. Now, listen, a lot of the people who have been anti-vaxxers or who have been vaccine hesitant and don't want to get it, one of the main things that they continuously point at, and I covered this in one of my recent videos with Marjorie Taylor Greene, as she was going on her deranged rant, she was pointing out that they haven't been fully FDA approved. Now, the difference between this full FDA approval and the emergency use authorization approval that it was previously under, it wasn't really like a difference in the scientific methods that they used to determine whether or not these are safe and effective. That was pretty much already done under the emergency use authorization. This is really just getting past a lot of the red tape of the normal processes that it would usually take in order to get something fully FDA approved. So it doesn't really change anything about the science of it. It's not like we learned anything new because of this or anything. This is just basically completing the process that had already been long underway with the emergency use authorization. So, there are a lot of people, like I was just saying, Marjorie Taylor Greene, one of the main things that she was saying in her deranged rant was that it's not FDA approved, or it's not fully FDA approved, and therefore it can't be trusted. And I joked in that video that I made covering that a lot of these people who are anti-vaxxers and say that one of the reasons that they're not getting vaccinated is because it's not FDA approved. I don't really believe that they're actually going to now and go get vaccinated and change their mind. They're really likely more to just change the goalposts and move the goalposts wherever they want to be and move on to the next reason why the vaccine is not safe or effective. I've literally already seen, this happened today, it happened within the last hour, and I've already seen clips on Fox News of them saying, well, did they rush this process and can it actually be trusted now that it's FDA approved? So they're just going to be moving the goalposts, and I don't think that among the people that are firmly in the camp of not wanting to get vaccinated, that this is going to necessarily change anything. I'm sure that people like Marjorie Taylor Greene will be going out there and making every excuse possible in order to continue spreading misinformation about the vaccine. But just to give you a perspective as to how many people have gotten this already, out of more than 70 million people in the United States fully vaccinated against COVID-19, more than 92 million have received the Phizer-BioNTech vaccine. I happen to get the Pfizer vaccine, and yeah, I'm doing great. I feel fine. No, microchips. I'm not feeling the heat from the 5G towers or anything like that. I feel great. I feel fine. And I'm significantly less stressed about getting COVID myself or what the consequences of that would be if I were to get COVID, as well as, the consequences of spreading it to my family members who are also all vaccinated. I'm happy that I got it. I recommend every single person go and get it if you haven't already. But yeah, my symptoms when I got it were very minimal, and I think that's the case for most people who get it. But either way, understand, regardless of what the symptoms or the consequences are of getting the vaccine, right, whatever they may be for individual people, unless you have some very specific illness that prevents you from getting the vaccine, the consequences of COVID would far outpace and outweigh the consequences of anything that could come from getting the vaccine. So I 100,000% recommend it. Now, let's move on to the idea of what this article is putting forward. So FDA grants full approval of Pfizer-BioNTech vaccine, and they frame this article as opening the door to more vaccine mandates. So this is something that I want to get your guys' thoughts on. It's something that I haven't really 100% made my mind up on what a vaccine mandate would actually look like, how it would be enforced. I see a lot of problems with, if we were going to have something like, there are some countries around the world that are enforcing it by using police who are going around and harassing people and checking vaccine cards. That's something I would like to avoid, because if you know anything about the US police system, then that would probably primarily be coming and cracking down on a lot of minority communities, especially. So I don't want to have any sort of vaccine mandates that are enforced by our police in any way, but I also understand the need for a vaccine mandate because of reasons like this. Okay, so I live in Georgia. I live in Atlanta. Georgia hospitals nearing capacity as COVID-19 cases rise. Here's how to check yours. So this is actually in the picture here. This is Grady Hospital. It's my local hospital, and Grady is full right now. Their ICU beds are at capacity. So this is why I would support something like a vaccine mandate, is because, listen, it's one thing to say you have the freedom of choice to do this, but there's no freedom of choice in a pandemic that is spreadable and contagious that you can give to a bunch of other people, and also that you would then potentially catch if you're unvaccinated and end up in the hospital. And so this is a situation that I don't think is acceptable moving forward. There's no reason why me or my family members or anybody else who lives in the community around these hospitals that are filling up with unvaccinated COVID patients, there's no reason why we should be punished because unvaccinated people just chose not to get vaccinated, and now they're showing up in the hospitals and taking up all the ICU beds. I don't think that's an acceptable situation. Whenever there's a COVID-19 surge, we're just going to have a situation where a bunch of unvaccinated people are taking up all of the beds, occupying these facilities, and then everyone else, whether you're in a car accident, have a heart attack, or some other various illness, that you would then be turned away from the hospital, and potentially you could lose your life because of somebody else's choices to not get vaccinated. And I also have, like, my girlfriend happens to be an EMT in Atlanta, and she tells me all the time, pretty much every single day, about the people that come into the ambulances that are unvaccinated COVID patients, and every single one that has COVID that ends up in the ambulances is unvaccinated. So there's an obvious clear trend. The vaccines are working, okay, at least at preventing hospitalization and deaths to a great degree. So we can't have a situation where a bunch of unvaccinated people are clogging up the hospital system and basically causing it to collapse at the expense of everybody else. That, to me, is not acceptable. So those are the arguments that I would have in favor of a vaccine mandate. But again, you have to really get into the nitty-gritty details and discuss exactly how it will be enforced, how you're going to be keeping track of it. And you got to make it as easy as possible for people to have access to the vaccines, as well as give them support systems in the case that they would have some symptoms arising from it. But tell me what you guys think about the vaccine mandates. Do you support them? What are your thoughts on them? Do you not support them? How do you think they should be enforced if you do support them? And let me know down in the comments.